So okay, it's 2:30, so we start our presentation. So how's everybody doing? I hope everyone doing okay in this pandemic time. So hopefully to see you all again back on campus in hope so few months time. And without further ado, let's in OSPE. So I will just tackle everything regarding the pathology question in OSPE. So I will start first. So my lecture, my topic today, I got two parts. The first part I will be presenting, or I'll be explaining on the contents or the anatomy, sort of anatomy of pathology questions. So you need to know the structure of the questions and all of the what they are expecting you to know. A sample questions to stimulate our brain this afternoon to try to answer a few questions. So no marks will be given, no penalty will be given, just just for fun and to familiarize you with the questions for this year one. So first of all, pathology question. So to answer any pathology, given question. So it consists of a scenario and the results. So I will explain it entirely in my next slides. So this three part, which is the scenario here, the gross, and also the histopathology, is usually based on the interpretation skills. So interpret the scenario given, how you interpret the gross pictures, and also how you interpret the pathology picture given. And for the next part, the knowledge is the part where they test your knowledge. So based on these three first component, and you need to come up with a diagnosis, and there are a few other questions that are related to the scenario, to the images that are given. So they want to test, the examiner want to test your content knowledge. Means this part you need to memorize, you need to remember all the facts that are related to the case. Okay, the first part is the scenario. So usually a scenario will give you some clues regarding what is going on with the patients or the questions. So they will give, usually this part usually contains a lot of clinical correlation, usually some age, gender, predisposing condition, and other relevant factors. Usually it will take just one or two sentences, maybe a very short paragraph which consists of a few sentences. But all of this information that are provided within the scenario is important and related to the questions that will help you in assessing the pictures given. So the next one is the gross part. So this part, as I mentioned, we test the data interpretation. Usually they will give you photograph. The reason why we give photograph is actually because we have two centers, usually because we have here in Kumangkurian and also another center which is in KLE. So it's very difficult to come up with a similar organs or similar specimen for exam. So sometimes, for example, in a breast cancer, so there is no two case presented as a similar breast cancer. So meaning if you take 2 samples of breast cancer, it will be a little bit different. So it's a bit difficult to synchronize because there are 2 centers. So to ease things up, usually we put a photograph of a specimen. So, but usually the exam will provide to you the most comprehensible and the most clear photograph to be given to you, so that you can appreciate the findings that are available in the photograph. So during gross part, you need to, usually the question will ask you to give a gross features. Usually maybe it depends on the complexity or the findings within the specimen. Maybe you'll be asked 2 or sometimes 3 features of the gross findings that you can see in the photograph given. And the most important thing during this part is actually you can score high point. You can get a lot of point in describing the gross findings, because the answer is in front of you. They are available in the photograph, and usually you just need to explain or write down the findings that are available in the picture. So the key point is usually students describe the thing that are not relevant to the picture. Sometimes when you read your textbook or you read your lecture notes, sometimes what the lecturers given in the lecture notes or what are available in the textbook is sometimes not related or not seen in the photograph given. So that sadly will cost you no marks given, even though it is true related to the disease, but it is not there in the photograph, so you won't get any marks for that. So, but what you can do is actually just to describe the most striking lesion that you can see in the photograph first, and by that you can score higher point or even perfect point for this part. Usually, if they ask you 2 to 3 features, so the marks is also 2 to 3 marks. So that's, for example, if they ask, if the examiner asks you 3 features of gross feature that are available in the photograph, then there will be 3 marks given for each features. So what you have to do is just, as I mentioned previously, just describe what you see in the picture. So you will score very well in this section. The next one is the histopathology part. Usually, this part is also will test your data interpretation. So they were given you a photomicrograph, and then you need to interpret the data or the photomicrograph given, and come up with the features. Usually, this part is also will be asked. The examiner will ask you to give 2 or 3 features of histopathological features that are available in the photomicrograph given. Again, as I mentioned, as similar as the gross part, you can score very, very well in this section if you describe the features that are available in the histopathologic in the photomicrograph. So please do not put down what you remember or what you read in the textbook, but look at the photomicrograph givens and try to, as hard as you can, try to explain or try to come up with the features that are available in the photomicrograph, so that you can score very well in these sections. So if the question asks you 3 pathological features, 3 gross features and 3 histopathological features, that will, if you can score well, perfect points at these questions, at this part of the questions, you can obtain at least 6 marks from it. So that already made you you pass the exam. So pathology is actually easy to pass questions, but it is a little bit difficult to score because there's a lot of things to remember at the knowledge part. So, okay, at this point, if you answer perfectly, you already passed the questions. the stations. And we go on for the diagnosis part. So usually after you have described the the gross findings, you have list down the gross features, you have list down the histopathological features. So the next question would be a diagnosis part. So they will ask you what are the diagnosis of this patient that you think that is the most relevant or the most the most accurate diagnosis for this patient. So you based on the scenario given to you and the features of gross and also histopathological features, so you should come up with a diagnosis. So you should give the most probable diagnosis. Do not give differential diagnosis, several diagnoses. What you need to do is just give one the most probable diagnosis. Next is you should base on the scenario given, as I mentioned, the gross features and also the histopathological features. Next, this is will test your capability to make a conclusion based on this is the part where they test your content knowledge. Okay, for the knowledge part, it will test your knowledge, meaning it will test your skills to remember facts about this case. So usually the question asks, maybe they will need the risk factors, the etiological agent, the pathogenesis, and other relevant investigations. So the risk factor is, I just explained a bit, the condition that put patient at risk to develop the disease. For example, if a patient is a smoker, he is at risk to develop a lung squamous cell carcinoma. And next, the etiological agent. The etiological agent is usually the causative agents or factors that are causing the disease. For example, in pulmonary tuberculosis, the etiological agent is Mycobacterium tuberculosis. So that is the etiological agent. But bear in mind, sometimes in a disease, it might has a lot of risk factors or a lot of etiological agents. So it depends from questions to questions, depends on how many the question asks you to give. So you give according to the questions. How does the question ask? The pathogenesis is actually how etiological agent or factors cause the disease. So if you were asked to give the pathogenesis, usually at this point, the pathogenesis part is usually they need you to just outline the pathogenesis. So you just start with the etiological agent first. For example, in primary tuberculosis, if they ask you the pathogenesis, you start with Mycobacterium tuberculosis infections to the patients or to the person, and then start from that and develop how pulmonary tuberculosis develop. And the last one is other relevant investigation. So I capital relevant here because sometimes when I mark this exam script or the exam answer from the students, it's a little bit disappointing because some of students just give a very general investigation. For example, in pulmonary tuberculosis, what are other investigation should you do to this patient? And some of the students just wrote blood tests. So what kind of blood tests do you do? So this is a little bit disappointing, and it won't give you any marks here. So to see that this student is excellent or not, so we test the knowledge part. So if the student is excellent, then he know the disease inside out and can and able to give answer that are relevant to the cases. So okay, so again, you need to be specific. For example, as I mentioned previously, in tuberculosis, blood test won't give you any marks, but if you say MEN2 test, then it's very good. Or you can say also sputum for acid fast bacilli or sputum for TB-CNS. So that will give you a lot marks, a proper marks compared to you just write a blood test. So you won't give anything. Okay, that's the end of part one because so we go on to the part 2, where we try to answer some questions. So I prepared to you a sample of questions. So let's go. Okay, before that, I give you a time to prepare, to get your pens and paper. You try to answer and we discuss along the way, okay? So I give you around 2 minutes to get your pen and paper. And I will start at 2:48. Yeah, something like that. I'll give you 2 minutes, okay? You can have a drink first and then we continue. All right, everybody ready? So we start our sample questions. All right. So managed to prepare a few questions actually, just to stimulate our discussion this afternoon. So let's go. Okay. The first part of the question, of any pathological question, the scenario. So I'm giving a 78-year-old man presented with history of perirectal bleeding for the past 3 months. The symptom is associated with loss of appetite and significant loss of weight. So it is almost the same like your PBL, what you used to have, every question will start with a scenario. So it will be given scenario, for example, like this. So we highlight the important point first. First, number one is a 78-year-old man, an old man. Sorry, I tried. Okay, the age is 78-year-old man, and he had a perirectal bleeding, and for the past 3 months, so sort of a chronic. So apart from that, he also had. Sorry, okay. He had also loss of appetite and also significant loss of weight. So they usually, just to cut things short, they won't give you how many weight, just as very significant loss of weight. So you just get that as a significant loss of weight, meaning there's a constitutional symptoms. Okay, next, for the second part of the questions, the photograph or the gross findings. All right, okay, sorry. Okay, the next part is the photograph or the gross finding. So usually you are given a photograph or a photograph of a specimen. So usually the question will explain, given a photograph, a hemicolectomy specimen of the patients. So this also will give you a clue that this specimen is what kind of specimen it is. So hemicolectomy means a part of a colon that had been cut off, or a segment of a colon that had been removed from the patients. So it is already open, as you can see. All of these are the rugae, and there's something at the center there. Okay, next is the list 3 gross features that you can see in photograph B. 3 marks. Okay, everybody can try to answer first, and I will give you around 1 minute to answer, to list down your answer. Don't worry, I won't get to you one by one. Just for you to mark by yourself, I will give you answer afterwards. Okay, so within 1 minute, I'll give you time to answer the questions. If you're not, you cannot see it clearly, I magnify it to you. So all right, 1 minute has passed. So we go on to the answer of this question. So you can see there's a lesion at the center of the colon here. So it's a bit red in color. You can see the rest of the colon is remaining intact. You can see this, the rugae here is still preserved, but there's a lesion at the center here. So how to describe it? Number one, you describe what are the most striking features first. Number one is there is an ulcerated lesion seen in the bowel mucosa. So you already mentioned there's one lesion. How does the lesion look like? It is ulcerated lesion and within the bowel mucosa. So all of these are the bowel mucosa basically. So there's a lesion, ulcerated lesion in the bowel mucosa. So you already got 1 point, 1 marks there. Okay, then you explain regarding the lesion. So how does the lesion looks like? It has rolled edge. So you can see the edge of the lesion. So this is the lesion. So the edge is actually at the periphery of the lesion. So it's a bit roll. Roll means if you are describing an ulcer, so any kind of ulcer, despite it is on the skin or on the bowel mucosa or on the oral mucosa, you should describe. There are a few steps to describe ulcer, but the most important thing to differentiate between the malignant and also the benign ulcer, meaning just stress ulcer, is the edge of the ulcer. So if it has a rolled edge, so means it usually is more of a malignant kind of ulcer. So rolled edge means the opposite to the rolled edge ulcer is the sharp or clear-cut ulcer. So if the ulcer is clear-cut, it will be hit like this, it will be sharply cut. Usually this you can see in stress ulcer or traumatic ulcer caused by some trauma. So it can cause sharply edge ulcer. But in the rolled edge ulcer, usually you can see the edge of the ulcer will become raised like that and become center like that, and another edge is like that. So if you cut here, but you can also see from the on top there, you can see the edge is a little bit rolled out. So I clear this one first. So you can see that this is the base of the ulcer, and the edge is from here to here. So actually, if it is a benign ulcer, there won't be a very thick edge like this. So it will be a bit more thinner edge, and the ulcer base is a little bit wider. So the lesion has rolled edge. So just to give that it is a malignant kind of ulcer, and the floor of the ulcer appear to be necrotic. And the one I mark here is the base of the ulcer. So how you can see is it necrotic or not. The necrotic, you can see there's a unhealthiness of the color. Sometimes you can see whitish spot here and there, like here, and sometimes you can see hemorrhagic here. So that's how the necrotic will look like. But don't worry, this one is not that good the image is not that good, but usually in exam, we will try to find the most striking features, the most how to say, the most clearer, the clearest picture that available to be submit to the exam. So, all right, if you describe like this, you already got 3 points here. So there's a perfect mark for the first part. Okay, sorry, there's a question there. I'll try to entertain the question first. The question is, can we mention elevated border instead of roll edge? Yes, you can. It is interchangeable. So you can use also elevated border or roll edge border. Sorry, Doctor, your line is breaking up. So is it okay now, Tina? So I just continue. I assume that everybody okay. Okay, next. Oh, sorry. Next is the photomicrograph part or the histopathological part. So given to you are photomicrograph B taken from the tissue of the lesion previously, so meaning the lesion in A, in gross part. List 2 histopathological features that you can see in photomicrograph B. So I give you a few times to reflect the picture and give some answers. So remember, just give 2 most striking histopathological features, 2 most striking. So based on this picture given, not from what you remember or from what you memorize from your textbook or lecture notes. So I'll give you another minute to answer it. So all right, what we next has one, and we see the answer. Sorry. Okay, how to describe? Okay, number 1, there are few atypical glands within the submucosal layer. So how did I know that this is a submucosal layer? So you can see that this part, let me change the color first. Okay, so this is, you can see it, sorry, I changed the, okay. So you can see that this part is the mucosa. And this, the rest of it, should be the submucosa. It is very difficult to say that this is the muscularis layer because you cannot see any muscles there except at this part where you can see some strips of muscle here. This is actually the muscularis mucosae where you can see at the junction between the mucosa and the submucosa. This is the muscularis mucosa. Okay. Someone asked. Sorry. Okay, there's a few more questions. I answer this one first. Okay, I'll tell you what. I will get back to the gross part after this. Okay. All right, this one first. So there are a few types of glands. Someone asked if you can say that it is back to back. It is very difficult to say back to back because the gland is not that, the amount of glands is not that much, so it's just very minimal. So you can still see the stroma elements here. So especially here, you can see there is some stroma here, and also here. So back to back is not that accurate in this context. But if you answer, sometimes if we still have a look back at the picture given to you, and if we find that it might be relevant, then we can also mention, we can still give mark, even though it is not present within the marking scheme. So okay, back to this question. There's a few atypical glands. Why they say atypical? Because the shape is atypical compared to this is the normal glands. So if you remember back your histology of colon, these are all the normal glands. You can see there's nice shape there with a lot of goblet cells, and the nucleus is basally located. So compared to here, the shape is atypical kind of shape. Some are star shapes, and it is aligned by atypical cells there. Okay, the next is the surrounding stroma shows desmoplasia. So desmoplasia, again, there's some increase in fibrosis in the surrounding stroma. So the stroma is where I put the line here. So all of these lines are the stroma. So here you can see this is the stroma, and so this is the stroma. Okay, if you answer like this or something that are related to the picture, then you have already obtained, able to get yourself 2 full marks. So yeah, so this is how you score in the histopathology questions. Okay, someone do ask for grossing part. So I will go back to the grossing part. Okay. All right. Okay. Can I say it is a protruding lesion? Yes, you can say it is a protruding lesion. But the most striking one, the most relevant or the most accurate thing to say is it is more of a ulcerating kind of lesion. Protrusion kind of lesion is the big difference. So protrusion means they are more likely to appear like a polyps kind of structure. So that's how you differentiate between the protrusion and also the ulcerations.
Doctor, what if I mention an inflamed lesion? Is it acceptable?
Inflamed is also not not suitable in this case, because you can see that there's some ulceration here. So inflamed means the overlying skin is the overlying structure is still intact, but there's some redness there. But in this case, it's already ulcerated. You can see there's a margin here, the ulcer margin. Sorry, the ulcer margin. Sorry. Okay, the ulcer margin here. Well demarcated, not well demarcated. Well, how you say, you can see there's a differentiation between this part and also this part where it is already ulcerated, or the overlying mucosa has already been denuded. So that's it's more relevant to these questions, to this picture. But don't worry, this is just a sample. But what you can see in what is given to you in the exam is more prominent, more a good quality compared to this one. So next question is okay, hold on, I'm trying to get back to the answer. May I know how to differentiate between ulcer and tumor? So tumor is denusion or tumor, ulcer is actually there's a loss of epithelial lining despite where it is, even in skin, any mucosa. And also tumor can also presented with ulcer because of the overgrowth of tumor, and it can become ulcerated and cause loss of the overlying structure and cause ulcer. So short answer is tumor can cause ulcer also. So that's why you need to differentiate between the benign ulcer and also malignant ulcer. So that's the short answer. Macrophage infiltrations. This one is for the next questions. This one, right? Okay. It's difficult. It's not seen in this picture. What you see at the center here. This one. So what you can see at the center of the malignant glands here is actually just necrotic materials that are present due to the overgrowth of the malignant cells. All right. Next is what if I sorry. Okay. What if I said the shape is like rosette pattern? No. This is not true. Rosette is for another type of tumor. It's not a very this not a features that are found in this type of tumor or adenocarcinoma. The rosette is usually found in the retinoblastoma and usually nerve kind of tumor. Is ulcerated same with fighting? I answered previously. No, it is not the same. Yes, one of you are trying to ask if you answer cellular features, is it do you get marked? Yes, you get marked for mentioning the cellular features. These are the answer I given here is just to just as a guide. But if apart from the structure, means the architecture of the glands here, you can also answer regarding the histological features or the cytological features or the cellular features to obtain answers. Obtain marks from there. All right. Okay, so we move on to the next questions or the knowledge part. So give the most probable diagnosis for this patient. So this one I won't give you times because it's just a simple just one word. So what you should answer is colorectal adenocarcinoma. So it depends on, sorry, where am I cursing? Okay. So it depends on the examiner. Some examiner will accept adenocarcinoma, but others will still need you to put in the colorectal adenocarcinoma. Why? Because there's a lot of adenocarcinoma can occur in a human body. So you need to be more specific even in the diagnosis. So you need to mention colorectal adenocarcinoma. So you need to answer this and also this. So you need to mention both. So if you just mention adenocarcinoma, some examiner will not give you any marks, whereas others might think to give you maybe half a marks for you. So there will be what you need to do is to score highest as possible. So you already know that this is a colon. So you already know that the features suggest you that this is adenocarcinoma. So when you write, you just put colorectal or colon adenocarcinoma. Anything is acceptable. So as long as you write the organ and also the tumor or the lesion that happens in this organ. So next is the knowledge part. List 3 risk factors for the above condition. So 3 marks given here. So what you can say is, so this one, what you remember, what you read from what you're reading, from what you heard in the lecture notes. So you can give answer based on what you remember. So list 3 risk factor is number 1, diet high in processed meat, familial adenomatous polyposis, and also some tobacco users. and other answer that you come across that are related or relevant to this type of questions. And the last one, state one relevant investigation to screen for the above conditions. So this is also where the knowledge that you remember or you read from your readings, from your lecture notes, you can find this kind of answer. So based on that, you can answer this one. So I just state already directly, which is the colonoscopy. So this is also another investigation that relevant. So remember the words relevant. Do not put a very generalized statement because it won't give you any marks, and it's just such a waste if you just put a very broad or a very generalized things. Okay, can low intake can be a risk factor also? Yes, can. As I mentioned, you can answer anything that relevant to this this condition or these questions. Yeah, what I put here is just a guide just to stimulate our discussion and also just to stimulate you, to familiarize you with the how does these questions will look like. All right. I think, okay, some take-home messages, just to recap back what I mentioned previously. All right, number one, read the scenario thoroughly, because the scenario will give you some ideas on what's going on to this in this question or in question that you are going to answer. Number two, list down the features that are available in the photos or photomicrograph. Do not list down features that are you just remember or come across to your mind during your exam, but take a look at the photo and also photomicrograph, describe it, list down the features that are relevant to the materials that are given to you. Next is only list down the exact number as required by the questions. So this one is another point that I usually stress from time to time to almost every student that ask me regarding the OSCE or OSPE. So you need to list down the exact number. If the question asks you three features, three gross features, you just list down three gross features that are relevant to the material given. So if you give, for example, what happens if you give more than what is asked? For example, if you okay, there's some question there. All right. Doesn't matter. What is the line or gap between mucosa and submucosa in the paragraph? Or that line is muscularis mucosae. All right. Again, what happens if you answer more than what is required? So usually, what will happen if your answer number one, number two, number three is all wrong, is or not related or not correct or accurate to the photo given, but your fourth and fifth answer is very, very true and very correct to the answer given, some examiner won't give any marks, even though your fourth and fifth answer is correct, because they will only take the first three one. But if your have a heart or very kind enough, they will read all of your answer and they will try to give you some marks. But usually examiner has to go through a few hundreds of marking sheets, so some might irritate the examiner and usually they won't give you marks, unfortunately. All right. Next, give the most for the diagnosis part. You need to give the most probable diagnosis. So no, don't give differential diagnosis, as I mentioned previously. Just give a very probable or very related diagnosis to the case given. List the most relevant investigation based on the question or scenario. Also, again, just remember the most relevant. Do not give just a general kind of investigation that are not related or not cannot point toward the diagnosis or the scenario they are given. Okay, the next one is help the examiner by writing neatly or at least comprehensible. You don't have to have a cursive kind of handwriting, but at least we as examiner is able to read, because sometimes if the examiner cannot read your handwriting, then they won't give you any marks at all, just for the handwriting part, because they cannot read what you write. So please write neatly or at least comprehensively. And do not forget your matrix number or exam number, because some of previous students do forget to write their matrix or exam number. And remember, please listen to the instruction given during exam, either to write in your matrix number or your exam number. So there are the different kind of number and different kind of purposes. So by that, I end my lecture. All the best to all the future doctors. And thank you. Any other questions you'd like to ask? Sorry, come again, not clear. Okay, I answer from the chat first. Okay, next is there any possibility to get a radiological image? It depends on the cases, but if it is from radiology, from pathology, there won't be any radiological images. How to know if the diagnosis is carcinoma or sarcoma? So you need to understand what is carcinoma and sarcoma. Carcinoma is a tumor or malignant tumor arising from epithelial lining. So meaning from the skin, from the mucosa and glands. So usually it will form glands, like adenocarcinoma, or if it is arising from the skin, can be squamous cell carcinoma, and all of that is carcinoma. But for sarcoma, it's arising from the mesenchymal. Usually it is, you can see like leiomyosarcoma, soft tissue, smooth muscle kind of tumor, leiomyosarcoma, or you can see osteosarcoma. That is a type of sarcoma. So it arises from mesenchymal component. It's not from the epithelial lining. So that's how you differentiate. But you can read afterwards details. Another question is, if I answer MRI, is it a general answer or an incorrect answer for the investigation? Okay, for MRI, in this case, for example, so for MRI, for example, you wanted to say MRI, you need to specify what kind of MRI investigation that you would like to do, because MRI is a very generalized investigation. It can start from head and up to toe. So if you wanted to say MRI, so you need to state what kind of MRI. For me, I suggest if you want to put MRI, you can say MRI of for example, of the abdomen, just to see if there is any involvement of the lymph node. So that might be correct answer, instead of you just wrote MRI. So you need to specify what kind of MRI and which part do you want to look for MRI. Same as I mentioned previously, if you wrote blood test, so there's a lot of blood tests that you can do. So what are blood tests that are related to this case? So you need to be more specific. Can biopsy be one of the investigation? In this case, I don't think so, because they already removed the colon, so there won't be any biopsy can do afterwards, because they already removed the tumor. And even though it is true before removal of the colon, but sadly there usually won't be any answer for biopsy, because it is not correct for this case. Next, may we recall what type of lesion characteristic? Sorry, come again. May we recall all types of lesion or characteristic, please? I'm not sure how to answer that one. Creep of Lieberkühn is available on the mucosa layer of the colon, right? But why there is an atypical gland in the colorectal adenocarcinoma? Okay, the atypical gland is arising, usually it's carcinoma arising from the colon mucosa. and it's spread downwards and it invades all the thickness of the colon. So that's how adenocarcinoma happens. So that's why you can see atypical glands in the colorectal adenocarcinoma. Is it possible if two features have the same meaning, so it will get 1 or 2 marks? So if you give answer two features, but these two features has usually the meaning is the same, you only get 1 marks instead of 2. So sadly, no marks for the second one. You will get only 1 marks. So any more questions? So if there is no more questions, I will end my lecture. So I hope you all the best and good luck for your exam and stay safe. Hope to meet you again sooner in USM. All right.
Thank you, Doctor.
Okay, thank you.
Thank you,
Thank you,
Doctor.
Doctor.
Thank you, Doctor.
Okay.
Thank you, Doctor.
Okay, you're welcome.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Okay. Okay, all the best. I will end my the meeting now.